Natural detoxification for heavy metals. Do you have fatigue that won't go away, brain fog, joint pain, or unexplained skin rashes? What if your body is warning you about a hidden burden? Subscribe and comment. Integrity Medicine, Soledad del Prado. In this video, I give you a step-by-step protocol based on scientific evidence to support the natural elimination of heavy metals using medicinal herbs. Symptoms of heavy metal toxicity. Heavy metals such as lead, mercury, cadmium, and arsenic accumulate silently. They do not have one unique symptom, but they do have recognizable patterns: neurological, brain fog, difficulty concentrating, fine tremors, anxiety, or mood changes; digestive, renal, recurrent nausea, constipation, liver sensitivity, or abnormalities in kidney tests; skin and appendages, unexplained hair loss, brittle nails, rashes, or dermatitis; general, chronic fatigue, muscle and joint pain, sensitivity to chemicals or odors. These symptoms are non-specific. The only way to confirm exposure is through clinical testing, blood, 24-hour urine, or hair analysis interpreted by a physician or toxicologist. Plants contain molecules with chemical hooks that trap metals and facilitate their excretion. These are the 5 with the strongest scientific support: garlic, Allium sativum, rich in allicin and sulfur compounds. High affinity for lead, mercury, and cadmium; cilantro, Coriandrum sativum, polyphenols and flavonoids that mobilize lead, mercury, and aluminum from deep tissues; turmeric, Curcuma longa, curcumin acts as a mild chelator plus powerful antioxidant. Protects the liver and reduces oxidative stress; moringa, Moringa oleifera, phenols and proteins with binding capacity for lead, cadmium, and arsenic. Quercetin, a flavonoid present in apples, onions, and capers. Multi-metal chelator and inflammatory modulator. Mechanism: these compounds surround metal ions, forming water-soluble complexes that the body eliminates through urine and feces. Dosage: to make it safe and effective, we divide the protocol into 3 phases. Golden rule: cycles of 5 days of use plus 2 days of rest to avoid mineral depletion. Preparation: week 1 to 2. Objective: open elimination pathways, liver, kidneys, intestines, skin. Initial doses: 50% of the therapeutic dose. Hydration: 2.5 liters of water per day plus soluble fiber, psyllium, chia. Active chelation: week 3 to 8. Garlic, 2 crushed raw cloves, let rest 10 minutes before consuming, or tablets, capsules. 600 mg standardized extract twice daily. Cilantro, 20 to 30 grams fresh in meals or 2 ml glyceric extract twice daily. Turmeric, 1 to 2 grams powder plus a pinch of black pepper with healthy fats, or 500 mg extract twice daily. Quercetin, 500 mg twice daily with food. Moringa, 2 or 3 grams powder or 10 grams fresh leaves in smoothies. Mandatory hydration, 3 liters per day. Without water, mobilized metals redistribute. Maintenance, week 9 to 12. Reduce doses to once daily or intermittent use 3 days week. Focus on repair, collagen, omega-3, essential minerals. Mandatory nutritional support throughout the protocol. Zinc, 15 to 30 milligrams day. Selenium, 100 to 200 mcg day. Magnesium, 200 to 400 milligrams day. Probiotics plus fiber to H after herbs. Animated timeline, phase 1, 2 and 3. With consistency, the effects become noticeable progressively. Stable energy and less post-exertion fatigue. Mental clarity, better memory and concentration. Clearer skin, stronger hair, fewer rashes, better digestion and intestinal regularity. Systemic antioxidant protection. How to measure it? Repeat heavy metal tests at 3 and 6 months. Compare baseline versus final levels. Also monitor zinc, selenium, and ferritin to avoid deficiencies. Realism: detoxification is a marathon, not a sprint. Solid results are evaluated between 8 and 12 weeks. Line graph, baseline analysis from 3 months to 6 months. Text: do not expect magical changes in 7 days. Herbs are powerful. They are not for everyone. Do not start if you are pregnant or breastfeeding, you have severe kidney or liver failure, confirmed acute poisoning, requires hospital care and pharmaceutical chelators such as DMSA, EDTA, known allergy to allium, apiaceae, or turmeric, organ transplant or active immunosuppression, under strict medical supervision if you take anticoagulants, warfarin, aspirin, clopidogrel, garlic and turmeric increase bleeding risk. You take antihypertensives or anti-diabetics, they may enhance effects. You have gallstones or an inflamed gallbladder. Turmeric stimulates bile. You are under 18 or over 70 years old. You are undergoing chemotherapy or radiotherapy. Herxheimer effect. Redistribution. During the first days, you may feel headache, fatigue, rashes, or a metallic taste. This is a sign of mobilization. If intense, reduce the dose, increase water, rest for 1 day. If it persists greater than 48H or there is fever, vomiting, consult a doctor. Reminder, natural chelators do not completely distinguish between toxic and essential minerals. Quick summary table for screen. Description: herb, adult dose, timing, metals, and duration. Raw garlic, 2 crushed cloves. On an empty stomach or light meal, 8 to 12 weeks, 5 to 2 cycles. Fresh cilantro, 20 to 30 grams. Main meals, 8 to 12 weeks. Turmeric plus pepper, 1 or 2 grams or 500 milligrams twice daily. With healthy fats. Oxidative stress, 8 to 12 weeks. Quercetin, 500 milligrams twice daily. With food, 8 to 12 weeks. Moringa, 2 or 3 grams powder. Smoothies or infusions, 8 to 12 weeks. Water, 2.5 or 3 liters per day. Divided intake. Excretion support. Continuous. Minerals, zinc, selenium, magnesium, separated 2 hours after herbs. This content is educational. It does not replace diagnosis, medical treatment, or clinical chelation in acute poisoning. Always consult a professional before starting. Detoxification is not a trendy ritual, it is a physiological process that deserves respect, science, and patience. Test before and after. Don't guess, measure, hydrate, nourish, and rest. Your body needs resources to eliminate toxins. Prevention, correction. Reduce exposure, filter water, choose low mercury fish, ventilate spaces, check old paint and pipes. If this video helped you, share it with someone who needs it. Subscribe for more evidence-based content. And remember, your health deserves professionals who support you. See you in the next video.